My name is Sudha Rani Tamiri. I'm 42 years old. I came here from Kukatpalli. My problem was glomus tumor in the little finger. We couldn't identify that this problem was there for a very long time because we couldn't know what's the exact problem, because there was nothing seen on the outside. Only on the nail I used to have pain, that when I used to sense the pain only when I hit something or when somebody presses on it. But the pain was very bad. It used to feel like current shock inside the hand, and it used to spread all over the full hand if something hits on the finger. This I have realized when I was around like 15 years old, but there was nothing seen outside, so we were not able to understand what exactly happened. And I just left thinking that there was some injury inside where I have accidentally got hurt somewhere, and I just left it like that to heal on its own. But later on I have realized as time passed by, it got increased. The pain intensity got increased. From last 5 years, I could see some changes in the nail as well. So my little finger nail started getting splitted in between, and it showed pink color, and it showed some kind of tumor kind of thing which is popping outside. And that the pain also got very worse. That even though nothing hits it, still it started hurting by it. It reached to a point where I couldn't even sleep in the night. The pain was like continuous, and I can't hold things properly because of that. I couldn't use that little finger for many years, and I went to many doctors to get it diagnosed, but nobody was able to understand. Everybody was just checking, and they took an X-ray, they took a scan, but nothing was seen inside. The pain was so intense that I was so scared to even hand it over to a doctor to see it. So I was just hiding it myself and trying to control the pain whenever it occurs. But it reached to a point where I couldn't tolerate at all. So that's when I was keeping on searching over the internet, seeing that if there is anything written about this particular thing. I have seen an article in online which is written by Dr. Devender Singh. So the images actually matched the same kind of image which I have right now. So that's when we saw the image and read the whole article, and we identified that it is glomus tumor and this needs surgery. And we have researched about other doctors as well, but since no other doctors were able to identify the problem and they started doing research on my finger, that's when I thought, no, somebody who has already done this is Dr. Devender Singh. I have to visit him. So the moment I visited the doctor, he saw it. He said usually we have to take MRI if it is not seen outside, but since it was very clear and I am also claustrophobic, so I couldn't go for an MRI. He did a clinical diagnosis and he said we can go for the surgery. We went for the surgery. They have sent the tumor for diagnosis, for biopsy, and the biopsy came out clean. Even the surgery was done very well. It was just done with a local anesthesia on the finger, and they have calmed me down very well, and they gave utmost care. Even the nurses, doctor's assistant, Dr. Praveena, she was also continuously taking care of me even after the surgery. She was keeping on checking whether I'm doing fine, and the nurses were also checking very well. Overall, I felt very good, and now I am pain free. It's just the cut pain whichever I have because of the surgery, but the shock pain and everything is gone, and I think I can comfortably use this hand within a month or so. So I'm so thankful to Yashoda hospital as well. They have treated very well, and the amount which I have paid also felt very reasonable for the kind of treatment they have given. Thank you.